Hope Channel, changing lives.
Good evening, and you are welcome to the consulting room. This is Mami Kosa, and as usual, we always have you on Monday evenings at 8 p.m. in the consulting room. We are starting a whole new series where you'll be seeing specialists in their fields. Yes, people that have so much knowledge about everything that they are doing. You'll be having some people come here that you might have heard of. There are some people that you might not have heard of. And today, definitely, you'll be seeing somebody that a lot of you don't know that side of him. And I was quite surprised with the responses I was getting when I posted the flyer on my status. A lot of people don't associate him with anything serious. They just think he's more into the funny side of life, but I'm sure he will surprise you today if you already don't know what he does. So you're welcome to the consulting room. As usual, we have Cocoa Milk being our major sponsor. So if you have any issues with dairy products and all that sorts, the best option for you is non-dairy, and Cocoa Milk is 100% plant-based coconut milk. It's good for kids, it's good for adults, it's good for everybody, so do well to grab it whenever you go out shopping. If you have any questions or any suggestions during the course of the program, you can send them to us on 055-968-0088. You're welcome to the consulting room.
Thank you. Thank you, Doc. How are you?
Please, I'm fine.
Sorry, am I?
Don't worry.
Yeah. How are you doing? You okay?
Yes, I'm fine. How are you too?
I'm good. You said some people texted you that
yes.
They didn't believe I was well.
A lot of people don't think you are a serious person.
Yeah. Those are disbelievers. Is it? Yeah. They are the ones that maybe God will come and they will see. They don't. Yeah.
They don't believe.
Doubting Thomas is here.
Well.
But a lot of people know me more for comedy than for optometry. So yeah, I'll give them the benefit of the doubt.
Is that a good thing or a bad thing?
For them or for
me? For you and for them. Or?
Well, me, I profit from both of them. So whichever you know me for, I don't mind.
Okay. So, why don't you just tell us a bit about yourself? Where you grew up, how your childhood was. We just want people to, especially the young people that watch this show, to know that it's possible for us to become whatever we want to be from wherever we are. Because most of us actually didn't grow up from Accra and the major cities. Yeah. We started from the outskirts and we are here. So maybe just a bit about yourself.
Yeah, so I'm one of those who grew up in the outskirts of Accra. Okay. I actually grew up in the Brunga region. My dad, Ivan Zakok, he is a civil servant, but he's on pension now. And my mom is a teacher.
So, for Mothers Baby.
Yeah, that's true. As the Mothers Baby teachers. So my mom and my dad, they were in Wenchi. I think I was born in Wenchi in the Bunga region. Okay. And then my dad was transferred to Kintampo. And so my mom had to go along, you know. Marriage. So and then from Kintampo we went to Drobo. Okay. Then from Drobo we went to Goso. And from Goso.
What? You kept moving?
Yeah, I mean civil servants, so they keep sending them to different locations, and everywhere they go, we go with them.
Oh, well, some of us, we lived in one place for almost all our lives.
Oh, that's cool.
I can't really relate to that.
So I went to boarding school in Brekum.
Okay.
Yes, Akap Complex, and then that was for GHS, and then primary school. I went to boarding house in primary 4.
Okay.
And then I completed in GHS there. And then I went to Popuari School.
Okay.
To study science. I was in 1 Science 1.
Okay.
Yes.
So you were in Science 1 or 1 Science 1?
Yeah, level 100. So from 1 Science 1. Yes, and then from there, I went to UCC to study optometry.
Okay.
And then, yeah, and so after school, I did my housemanship at in Sawam
Oh, you
government.
people also do housemanship?
Yeah.
Sorry, I didn't know that.
You didn't know. Now you know.
That's nice.
At Insawam Government Hospital. And so, yeah, and from Insawam Government Hospital, I've worked with a lot of eye clinics in Ghana. I've worked with Gokals.
Okay.
I've worked with Amasha. I've worked with... after school, the postings hadn't come.
Yeah.
And then the private clinics
Typical
were...
Ghana.
Yeah, you know what I'm saying? Yeah. So
my postings have not come.
Still?
Yeah.
But you're working, right? That's what I'm saying. So I had the chance to work with Dr. Riafe.
Okay.
He's also an Adventist,
Okay.
a very renowned ophthalmologist in Ghana, and in fact, Africa as well.
Yeah.
He runs Wartburg Eye Clinic at Otubreku.
Along going towards Cape Coast.
Going towards Cape Coast. On your left, if you are going.
Yeah.
So Wartburg Eye Clinic, I worked there from after housemanship. So I worked there for about 4 to 5 years.
Oh wow.
Yeah, that's why I stay at Kaswa. You understand? Because I needed to be closer to
work.
Yes, but I was trying to go from Insawam, where my parents were then, to the place, and it wasn't too conducive. Yes, so.
And the traffic.
I know it was tough to close. And you see, there's traffic on Insawam Road and traffic on Kaswa Road. So I had to find a place to settle
3-4 hours in traffic every day.
Yeah, and by that time, comedy was now catching up. So
I was going to ask, when did this whole comedy part of you come? When did you take it serious? But you just... Yeah,
so you asked that later?
No. I'm sure you talk about it soon.
Yeah, so comedy hadn't really... So I was more into the 8 to 5 weekly showing up for work and all that. So I worked with Wartburg for about 4 years, and then I decided to do freelancing. Okay. So now I'm more of a freelance optometrist, because that was when, after comedy started catching flames, and I started getting the attention, I realized that the 8 to 5 commitment wasn't for me. Because there are times that somebody, maybe a corporate company would want you to, they would be going for maybe a retreat. They would need you for maybe Wednesday to Friday. And then
you have to tell your
boss, and he's not around, so you have to be there and all that. So I realized that I'd have to find a way to juggle between the two. And so comedy actually for me started in UCC professionally. When I was in the boarding house in Brekum, we would have variety nights, and then I would be doing them Komode and Okalatin. Yeah.
Oh, so you started from there?
Oh, yeah.
With the paintings or without them?
Well, I did more of, I had a family relative who was one of the people. Okay. I think, is it Ochinoko, or if my mom is watching, she would know. One of our family relatives was part of the slapstick comedians, the Commoders and all. So, yeah, it was.
It's genetic.
I would say. And then, and my dad is also very funny. My mom is too. So,
I think I've watched a couple of your live videos or record. I don't remember if they were live, and you were home. You guys were trying to sing. It's quite funny to watch.
Yeah. It's a funny family when you get to
your brother too is quite. I've seen him.
A lot of my jokes, he's the one who gives them to me.
Oh, great.
Yeah, so he's one funny guy, and then my kid's sister, the youngest one, Obapa, and then Owusia. So the comedy started from primary, but made it really professional when mates in UCC suggested that I should do that. I should make it professional. The NAS people. So when we went to UCC, I'm happy I'm telling this story on Hope. When we went to UCC, we go for level 100 trips, the freshers and then I'll stand in the bus and be telling them jokes throughout the. And those days were people's jokes. I'll just be telling them, and then people were laughing, and we'll go and then be coming back, and I'll still be telling the jokes. So Margaret Boahima, Nibote, Nemo, and a couple of others, sorry,
All right.
realized that there was some potential in me. So they said, why don't we try and organize our first show on campus
Okay.
in UCC? Then I was in level 600.
Oh, so you didn't even start?
No, my first show
on.
wasn't, no. Then, okay, so NAS UCC gave me a very good, how do I say, platform to start my journey as a comedian, because House of Praise, they would ask me to MC, and then I'll be telling jokes, and then and then,
I think I first saw you ahead of you when we came for a program at UCC.
I was
a very
amongst
first time.
SD. I was very popular there. Yeah, so sharing a few jokes and all that, you know, being involved in NAS activities. At a point, I was welfare chairman for the association, and also it gave me more confidence to talk to people. Yes, and I used to also give testimonies. That's what knows. Testimonies was my thing. Like even if I tripped and then I didn't hurt myself on Wednesday evening. Yeah, so
Thanksgiving is
I know, right? Thing. Yeah, but people were still. I mean, like, people get annoyed at anything now. So, but I mean, that was how I got groomed into being a very good public speaker. So Margaret and the rest, they put money together, especially Bismarck.
Okay.
Bismarck, and then Bismarck, we used to call him Matinga. I've forgotten his other name. Bismarck Kusi, then Richard Opoku-Mensah. They put money together for our first show on UCC campus. And in fact, the whole of the audience, most of them, like I would say 80% were Adventists. Yeah, they were Adventists.
Supporting their own.
You know, so I would never forget that those guys who came together to support me. So it was on that event that I realized that we could do something. With my. So I did it with my. It was me, Fakao. Fakao didn't pursue comedy anymore. Headmaster, he also seems to be there or not there. And then one other guy, I've forgotten his name, but I remember his face. We put together the show. It was captioned "One Serajai."
Hey,
I mean, that's how confident we were in our material, and it really went well. So from there, I actually decided to pursue it as a serious professional career. And I completed UCC in 2014.
Okay.
Sir? What am I new? So in 2014, I completed school in 2014, and then did my housemanship in Salom 2015. So it was during that time that I watched a couple of comedy shows. It was hosted by James Brown at Coffee Lounge, Silver Lounge, where when you go to Silverbird, when you go to the mall where the Burger King is now, there used to be a place called Silver Lounge. So that was where they were holding comedy shows. And they were doing it in English. My first show I did was in Chi. And so I wanted to study how it goes. And I went to see the first show, paid to go see. And then I realized, I could convert my Chi jokes into English and then see how it works. And that has been the story since then.
Oh, you've had an eventful life.
Yeah, very eventful.
I don't think it's been easy, but then it's turning out.
Not at all.
Quite good.
Not at all. A lot of, people would, especially for an Adventist. It's quite tough for people to accept you. People to because we feel like we do not want to open ourselves for ridicule. So that's like how it is.
Our principles are already hard to go by. You have to be very strong to
be very in this world.
Then you already put yourself there for people to scrutinize you all the same. So we'll go for our very first break, and when we come back, we'll go to the eye doctor part. He will tell us a lot about things concerning the eye, and as usual, if you have any questions, you just send it to us, and Dr. Amponsa, as I've been calling him, would give us all the answers that you need. So do well to stay with us.
Cocoa dairy-free coconut milk is a fully plant-based milk, non-curdling in tea or coffee, and it's a lovely treat with any breakfast beverage or meal. It contains calcium and vitamin D2 for strong teeth and bones, and vitamin B12 to help boost your blood for vitality. Cocoa is 100% vegetarian and is approved by the Vegetarian Society of UK. It's also lactose and dairy-free, which is good even for people with lactose intolerance. Cocoa, get one today. Cocoa dairy-free coconut milk. Nature's health at your doorstep. For bulk purchases, contact 027-444-0180. This advertisement has been vetted and approved by the FDA. Cocoa dairy-free coconut milk.
Hi, good afternoon. You've just contacted Elise McCarthy Healthy Foods. How may we help you, please?
Hi, anyway, I really need your help. I've heard about you, but what do you do? Like, what do you do?
Elise McCarthy is an agro and food processing company. We do catering, we do food hampers. We cater for corporate lunch and breakfast.
You know what? You know what? It's exactly what I need. Because at this moment, I really need a food hamper for a board chair who is sick. I would love you to deliver that to him. And also, I've recruited some staff in here. I need lunch. And then my in-laws are coming this weekend. I will need food. I really need food. So I don't know. How do I go about that?
You are at the right place. We would send you a WhatsApp message and then we can conclude that for delivery as soon as possible.
God, thank you. Thank you. So I'll be on guard. I'm waiting, please.
Elise Mukasi, confidently different.
The consulting room. We have with us Dr. Amponsa, and as he's popularly known, Obi Amponsa, Obi. I'm sure some people call him that. And he's an optometrist. He's been practicing for the past 8 years. Yes. So yeah, he is quite well known in his field, and a lot of us know him to be a comedian, but then he also practices as an optometrist. So Obi,
Hi.
About practicing optometry in Ghana, is it rewarding? And if you were to come back, I know we don't believe, if you were to be given the opportunity to go over life again, would you still be an optometrist?
Oh yes. Yes, for the past 8 years that I've been doing it as a licensed optometrist, and for the 6 years that I was doing, how do you call it, when you are still in school and then you go for, there's a name for it, when
Internship?
Yeah, during those times that
So
I was
14
intern,
years.
you know, so the joy in helping people regain lost vision is very fulfilling. It is very fulfilling, and I wouldn't trade it for any other program. I wouldn't trade it because optometry in Ghana is young.
Okay.
It's young.
Yeah, we don't have a lot of you around.
Yeah, it's young and it's burden. And so there are a bit of challenges when it comes to maybe salary-wise and all that. But that's notwithstanding, we have very good executives in place who are still pushing for our bill to be passed. There's this bill that we have been trying for Parliament to pass, so that we get quackery out of the system. Okay. Yes, and once it's passed, then we have, like the pharmacy council who can walk into a pharmacy and seize drugs and all that. Yeah. Yes. So, but we cannot do that because you don't have the bill to go. Yes. So
you don't have the law backing you to do that.
Yes. So we are with the Allied Health Professional Council. Okay. Yes. So we have their backing, and they are the ones that actually help in these regards, like stuff like this.
I hope the bill is passed, so that just like how we have all the medical and dental council and the pharmacy council, you guys can also get your counsel to help you in your dealings.
Sure. Okay. I hope so too, because optometry is very rewarding. It is very rewarding, I wouldn't lie.
Hey,
it is.
Yeah, convincing me.
Oh yeah, it is.
Anyway, is it all about glasses? I'm wearing one. I'm a client. Is it all about glasses?
No, it's not.
Are you sure? Because that's all.
So it depends on the complaint you take to the doctor.
Okay.
You understand? So optometry, when you look at it, really, the name optometry, opto and then metry. So it's like measuring metrics and then eye.
Okay.
You understand? Yeah. So basically, basically in our name, optometry is supposed to be measurement of eye issues and all that. So primarily, we would need to we attend to diseases. We attend to refractive conditions. We do vision maintenances. We do vision rehabilitation. There are people that we do low vision care for. There are people that you may think have lost all their sight. Yes, we do pre and then post surgery patient care as well. Okay. So we work hand in hand with all the other health professionals in the eye sector. We work with ophthalmologists, with ophthalmic.
The ophthalmologist is basically a doctor who is specialized in eye.
Yes.
So that's different from an optometrist.
Yes. So let me explain. So there's the optician who fixes the glasses. Okay, let me start from the ophthalmologist. The ophthalmologists are the ones who do the surgeries. The medical doctors, and then the optometrist is optometrist is the primary eye care professional, the one that if you report to the clinic, most likely the doctor that will see you would be the optometrist, and he can diagnose, he can prescribe. Like there's that kind of autonomy for the optometrist to attend to a patient, and we do that in an interpersonal or interprofessional patient care. Okay. So if the patient's condition needs a referral to the ophthalmologist, it's done. If the ophthalmologist needs to refer the patient to the optometrist, that is done. Okay. Then there's the ophthalmic nurses. There are the ophthalmic nurses who also work to help the ophthalmologist and also the optometrist. Okay. You know, nurses. And,
they are
what they do.
The backbone of most healthcare professionals.
Yeah, and then the opticians are the technical people.
Okay,
the ones who fix your glass.
Okay.
You understand? So the eye care system is a whole, like it's a conglomerate of very good, hardworking people, and optometrists are like
part of it.
Yeah, we are pivotal part of the whole eye care system.
Okay. So I think that's why you guys are also called doctors.
Yeah.
Some people don't understand why we have medical doctors who are specialized in the eye and optometrists, but I guess this explanation works quite well.
Why. So when you apply to study it, you apply for the doctor of optometry course, and in fact, after your 4th year, you are given the bachelor's in ophthalmic science. Okay. And then you earn a degree after the 2 years. So it's basically, I mean, we have people, shoe doctors and also, I mean, if somebody goes to school for 7 years and then comes out and then has the autonomy to attend to a patient.
Yeah, the person is a doctor in this.
Yeah, you can call him Mr. but he will attend to you regardless. So yeah.
Anyway, okay. What are some of the common systemic or general diseases that you can diagnose from just examining someone's eye?
There are a lot. There are a couple. That's why we always advise that patients don't play with their how do you call it, their lifestyles. Yeah, we always advocate healthy living because whatever you do has an effect on the eye, especially for conditions like diabetes. You can look into the eye and then you find that maybe a patient has diabetic retinopathy, where like there are leaking vessels in the back of their exudates. They are like signs that gives you
the person might not know they are diabetic, but then from they coming to see you, you can recommend them to see a general
physician. Or there are, even for diabetic patients, for some of them who come to you for eyeglasses. Those who have the fluctuating ones, they don't have that stable sugar level. If you give them a glass now, and then the sugar level fluctuates, they wouldn't be seeing well with the glasses.
Okay.
Now they would assume that you didn't
Give
really
them the
take care of them,
proper-
but then it's because of, so it's not just diabetes, hypertension, sickle cell. There are a lot of other conditions that you can look into the eye, and because the vessels are quite thin, so the least pressure is
Causes
yes,
issues.
and yeah, so very systemic conditions affect the eye. They do affect the eye, even for some people that do not have enough sleep.
Oh, okay.
Yes, people who do not
So
get
by
enough
looking
rest.
inside my eye, I can see whether
Oh
I'm
yeah,
sleeping
some people
well or
come
not.
to you and they say their lids have been shaking, their
Yes.
eyelids have been shaking.
My own has been shaking.
Have you been getting enough sleep though? There we go. You understand. So yeah, the eye is actually the gateway into your body.
Yeah.
And so we always advise that people take very good care of the eyes. Yeah.
Okay. All right. So what are some of the common? Yes, we know that diseases happen all over the world, but then what are some of the ones that we commonly experience here in our part of the world? The
You mean-
common
you mean
eye
in
disease
Ghana?
Yeah.
Well, for the 8 years that I've been practicing, the main one is is usually conjunctivitis.
Okay.
Yes, whether bacterial.
So please, we like
So yeah.
basic English. What is that?
So conjunctivitis is an inflammation of the conjunctiva. Now the conjunctiva is a thin lining on the
Anatomy. Come back to
let me
English.
explain. So okay, let's say the white part of your eye. Let's say the white part of your, that what covers it when it's inflamed, when it becomes reddish, by whatever means, maybe by bacterial infection, by a viral infection, by maybe an allergic reaction. So we have different types of conjunctivitis. We have the allergic conjunctivitis where people react to stuff, maybe a perfume, a pollen grain, whatever that got into the person's eye. They scratch it, then they report, and then you see all those brown stuff gathered around their eyes, and then some come with very red eyes, especially during the times of Apollo. Yes, so, and there are ones that you see they sleep and they wake up, and then their eyes are stuck. You know, the discharges, purulent discharges in the eyes.
It dries up and then
it dries up, and then you see that. So bacterial, viral, so conjunctivitis are like the main, and then I think there was a research done by one doctor that I've forgotten the name, but he worked with VRA on that, and he came out with the diagnosis. He came out with that abstract, that conjunctivitis, and then the next will be cataract.
Okay.
The next will be cataract. Now,
people
confuse
local
yes.
language.
People confuse cataract with glaucoma.
Glaucoma, yes. A lot of people do confuse
But
that.
cataract is basically a lens opacity. So God created us and then put in a natural lens for us. You understand? That is supposed to be clear. So by whatever means, if maybe it was trauma, whatever got the lens to be opaque, cataract is what it is called. So an opaque lens is cataract. And a lot of Ghanaians
have it.
Yeah, especially in the rural areas. And the truth is that cataract is very manageable, like it's curable. It's curable.
But unfortunately, we sit and wait till nothing can be done about it.
Yes, but in fact, if it doesn't matter how mature the cataract is, as long as the nerves in the eyes are working and then react to light and all that, once the cataract is taken out, even if you cannot see the back of the eye, it's assumed that the cataract taken out would restore a bit of the patient's vision.
Okay.
You understand? Yes.
So it's never too late.
It's never too late. It is never too late. So if you have a parent, a relative, and a lot of NGOs and other government organizations are helping out with cataract surgeries, free cataract surgeries that are sponsored. And so
you don't have to pay much.
Yes, yes. And I know the national health insurance also takes care of a bit of it. So
for something that is so common, I think they are doing a bit well.
So cataract will come second, and then glaucoma follows closely. Glaucoma is a disease that affects the nerves. So, and the thing about glaucoma is that it is subtle. The symptoms, usually people go to the clinic because they have eye problems. They don't go for routine checks.
No,
unless you don't go for routine checks.
I go like once every 2 years when I remember, which is wrong. I know,
but at least you remember. Yeah, there are some people who actually brag about it.
Oh no!
For the past 5 years, I haven't been to. But sometimes you need to go check, because some of these things, especially for glaucoma, the signs you wouldn't know. It would take a professional to see that, because for glaucoma, the nerve damage starts from the peripheries, and so you think that you are seeing well.
But then
because you are seeing straight. So some people will be walking and they will be hitting stuff because they can't see their sights, and they think they are okay because their central vision is fine. But then it keeps deteriorating until it becomes a tunnel vision, where unless you turn, you wouldn't see somebody. You understand? So if, like, I'm looking straight to the camera like this, and I raise these fingers, as I'm looking at this, I should see these two fingers in my field of vision. You understand? But for glaucoma patients, they are unable to, or patients who have their nerves deteriorated, they are unable to see these. And you realize that it affects their visual field as well. So the visual field gets messed up, and then it is not
but
curable.
Then when you seek early treatment, it can be managed.
Yeah, that's why I was going to that. If a nerve gets damaged, it is difficult for it to be repaired. It is.
Science hasn't gotten.
The science hasn't gotten to that point.
Yes.
I hope they get there.
I hope so too, in my lifetime.
I hope they get there. But if it gets bad to a point.
You are saying they as if you are not.
Yeah, we when they come, well, did you invest in COVID vaccine? Did you work with that?
I received some.
Exactly. So let the researchers do their work. So glaucoma is. In fact, and for some people who come, some are coming for glasses, and they get there. You do ophthalmoscopy, look at the back of their eye, and realize that things are worse there. You understand, and need to be taken care of quickly. So glaucoma can be managed when it's detected early. Early detection is what helps in the management of glaucoma. But some people, by the time you get there and then it's worse, then you just need some tender loving care. That will just keep you active. So glaucoma, then we have dry eye. Dry eye is more prevalent in older folks. Yeah, so when you blink, tears lubricate your eyes. And so the more you blink, the more the tears lubricate your eyes. And then the tear is made up of a number of layers. The lipid layer keeps the tears on the eye for a while. Once the lipid layer deteriorates, the tears do not stay that long. And so when the tears do not stay that long and then your eyes are open and from afar, it gives you that burning sensation. And so some patients come to the clinic and say, me was abusia egumeniso anya. That's it. That's the burning sensation. Yes, so that's the dry eye syndrome that happens especially for older folks. Yeah, so those are like the common ones. The most common.
I hope with all the symptoms he has been talking about, if you are having any of these things, kindly go and see an optometrist. I'll let him tell us where he's working so that you can go and see him to at least welcome a celebrity, I'm sure. Anyway, so you've spoken about the symptoms and the common eye diseases together. How often? I mentioned that sometimes I go every 2 years. Sometimes when I remember, I go maybe twice a year. It's not every time. I've not been consistent. How often should I go for eye check or eye checkup if I don't have eye problems, and how often do I need to go if I have a problem?
Yeah, so what we believe in, I know you believe in too, is that patients need to come for review.
Yeah.
After check. Yes, you need to go for a review to see how the medication that you were given worked. But for Ghanaians, once the thing works, that's it. They wouldn't come.
Forever.
Yeah, so what I advise first of all is for people to make it a habit to report for reviews. There are some conditions that you want to treat within 2 weeks and see what other treatment you would follow it up with. But patients wouldn't show up. And then, yes, it affects, their non-compliance affects the drugs that they are given, because now the body starts resisting the drug because it didn't really finish the work it's supposed to do. Apart from that, I'll say that ideally, every 3 months you should get your eyes checked.
Okay.
Yes, if you cannot do it monthly, every 3 months you should get your eyes checked. And then for people who wear glasses as well, you would want to review their glasses in maybe a year or two. Just maybe you may not need to change it, but you just need to review it. Yes, it's just important to have that.
Okay.
I think we need to cultivate the habit of going for regular checkups and then reviews as well.
Okay, so now that you've advised us about going for the checkup and review, what do I need to bring along generally when I'm coming, especially for first visit and for reviews? What do I need to bring along when I'm coming to see you?
I almost said your eyes. I almost said bring your eyes.
Okay.
But yeah, so this is it. For patients who come for reviews, it is always advisable you come along with drugs that you were given before.
We don't like doing that.
We don't do that. We draw say man farm out. Hey, you know my journey.
Your friend is
yellow
color,
white. Yeah, so it happens a lot. So when you are going for a review, you've been attended to already. You go to the doctor with the drugs, even if you have not been attended to by that doctor, and it was by another doctor.
You need to.
Yes, you go, especially when you don't remember the name of the drug. Also, if you may have gone to a pharmacy for a first aid, whatever it is that you went to, you need to also go to the hospital with that prescription or whatever you were given. Yes, and so basically, when you are reporting to the eye clinic, it's advisable you go with your drugs. Also, it's advisable that you go with maybe a friend, or especially people who cannot handle themselves, especially ones that their vision is very that bad. Yeah, they need company to get there. So reporting to the eye doctor is very important, but make sure that you help him help you. And so for some people, in fact, history is very important. What you've been up to. Some people come to the clinic like parents with their kids, and then they try to scare the kids. You understand? The kids are unable to talk to the doctor about their problems. I feel like it's a Ghanaian thing, where we are brought up to be timid and quiet. So even when we are sick, you cannot say, baby, yeah, because some kids cannot even read from the board. They'll have to sit in front and then be squinting. But when they go home, their daddies or mommies, like today, I had a patient, and then while I was attending to a patient, the daddy said, we do for eyeglasses. I was like, there are younger ones that are
the child before the child even has it.
And this could affect the child. Because the thing is, you see, you have two eyes, okay? If one goes, it's left with one. If the other one disappears, that's it. You are now going to be dependent on other people. So we need to really take...
And our society is not kind to people that have lost their eyesight.
Our systems are not even well placed for disabled people. So if you are able now, you don't have to get yourself into that phase. So people who come to the clinic should try and then listen to the doctor. He knows best. That is why you are there to see him. He wouldn't come to your banking or to tell you how to count your.
I don't come and tell you how to balance your
Exactly,
books. I can't.
exactly. So I feel like we should allow the doctors to do their jobs if your kid needs it. Glasses now are not. You shouldn't have that stigma that it used to have those days. You understand that? Hey, you know, where they were because
2 eyes, 4 eyes.
because quickly, if I want to educate people on how glasses work, let's say the eye has a power. Let's say the eye has a power of 50 diopters. So not all of us match up to that power.
Yeah.
You understand? You need 50 diopters to maybe see the TV behind you. But then some people match up to like 49.5, some 50.1. So your refractive error, once it's corrected, once you wear the prescribed glasses, it neutralizes the error. You understand? So refractive errors are not even diseases; they are conditions. Yeah. So how your eyes, some have longer eyeballs, some have shorter eyeballs, and so when images are being formed on their eyes, the images appear blurry, and that's why we squint so that we are able to get the images clear. People who work with lenses know what I'm talking about. So we try to squeeze our eyes, squint, and then see if we can see better. But the glasses take care of that
So that
problem.
you can relax.
Yes, and that's how it works. But once you take it off, your eye is still the same. So some people wear glasses hoping that it will change.
Yes.
Yeah.
I was going to ask that question. Does glasses cure eyesight problems?
No, once you wear them, that's why I try to explain the optics. So once you have it on, whether it's a diverging lens or a converging lens, it does its job to make you see better. You understand? Even for older folks, from 40 onwards, like when they are reading, you'd see somebody and then they'll push their
Or glasses not cry.
Yeah, no, yes, and it's because they are the presbyopic stage, and from that stage, it's natural. It's God that has formed your eyes for you.
We
So
don't want to accept it.
we don't want to accept it because when you see our skin shed off, right? But in the eye, the old lenses, the old lens tissues remain.
Okay.
They are not discarded. They remain. New ones come, new ones, and so the accommodative, like prowess is really, and so you need glasses to help you see. And that's it. If you take it off, you are not going to be able to read your. That's why maybe your dad will say, "Bring me my reading glasses to read the Bible." Yes. So.
So, what of this? I don't know if it's a misconception that when you wear the glasses, your eyes get worse. Is it true?
No.
It doesn't
it's not
get
true.
worse.
It doesn't. And some people say your eyes get smaller or they get bigger. It's because you see when you look at somebody who wears the glasses for a while, you see their eyes through their glasses. You understand? So it depends on the kind of glass the person is wearing. If the glass tends to magnify the eye, and you see that for a while, once it takes to you're like, hey, you know, so it's just psychological.
Okay.
It's just psychological.
All right. So the fashion of wearing shades, and by shades I mean the ones that we buy from the roadside. These at first it used to be 5 cedis. I think now they're to be like 10 cedis.
How do you know their price?
Please, I live in Ghana. Oh, I've won some before. I've bought some.
Yeah,
before.
me too. Me too.
Yes.
I bought some before.
So we share the flags. Are they good?
Well, shades for life. I mean, fine, but what I wouldn't advise is to go get prescribed lenses from the roadside.
They sell it too.
Yeah, I see a lot of people. Like that's why I always am advocating, and not just me. All optometrists in Ghana are advocating for the bill to be passed, because the thing is that you would see somebody doing quackery by the road, but you cannot stop him.
Yeah.
Because you see, they just pick the lens, put it on, look in the mirror, and then think they are fine. But then that will go on to, because like you asked earlier, can a glass make your eye worse? It can do that if it's not the one prescribed for you.
Yeah.
You take it off, you have frontal pains.
Paracetamol and you're taking it, you're spoiling your liver.
That's true.
Yeah.
So you take it off, you have frontal headaches, you know, you are having all these kind of problems, your eyes are teary, and then you wouldn't even know the source, but you still wear that glass that was prescribed you. So I'd always advise that if you need glasses, you go to the right person. That would be the optometrist. And
Well, yeah. So we have 2 questions from 2 viewers. Willie from KJB. I hope I pronounced it right. He says, please, can I select a reading glass by trying from different glasses, or I should go for a test before?
Yeah, that's what we just talked about. Because these reading glasses, you may, because you see, maybe you may need a +2 lens to be able to see well. But then you'll be given a +3 lens. Of course, the letters will be bolder. You understand? But then it will have repercussions on you. So it's advisable that the right person, because some people, it may not just be the near, it may not just be for reading. You may have problems with sight as well, and far sight as well. And so you may need to combine both prescriptions to give you just that for near. You understand what I'm saying?
Yeah.
So it's not advisable to do that.
Okay, so Daniel in Santase is also saying, good evening and thumbs up for the educative program. His question is that, are there risks involved in one having wet eyes as opposed to dry eyes?
Wet eyes?
I think maybe teary eyes, I don't know. Daniel, if you're still watching, maybe you can explain your question further, then Doc can give you a better answer, I guess. So,
but then there are watery eyes, though. Watery eyes usually are symptoms of a viral infection. Yes, and maybe the advice I would give is that when, especially for those watery eyes that make you realize the eyes are red and becoming puffy, when you are treating it, you don't wipe the eye with a handkerchief.
Yeah,
you understand? Yes, we do that a lot. Even with the discharges, we use handkerchief, then it discharges again, use handkerchief. The truth is that once you keep doing that, you keep reinfecting the eye with the same handkerchief that you used to clean the offending agent. So it's better to use these disposable tissues that are very available now. You use it, then you dispose it. Yes, and that would be the best.
Yeah, that makes sense. So do we have certain foods? So growing up, I've been told that carrots, if you eat carrots, when the way I chew carrots, that I'm still photosensitive. Well, I am just photosensitive, thankfully. So do we have foods that can improve or cause eyesight problems? There are 2 questions.
Yeah.
Improving eyesight and causing.
Improving. Yeah, I mean, like you mentioned, carrots are foods that are rich in vitamin A, I mean, the essential vitamins, vitamin E as well, the carrots, the leafy foods, the proteinous, the sours, and then the, yes.
Oh, but mama, maybe
but those are good. Yes, those food that we used to eat when we didn't really know much about technology, those are the ones that keep us. Yeah, they really keep the eye in check. Yes, even for oil, the red oil.
Okay.
Yes, that one helps as well.
But we want the frito. They will go and complain that the price.
Yeah, anyway.
Anyway, so we have some more questions. Please, Dr. Obi, what happens to the Dr. Obi? Please, what happens to the sight of someone who works with fire for a long time? This is Sami from UCC.
Yeah, fire. People who work with fire for a long time, especially our mothers who bake, and they usually report to the clinic with a lot of dry eye complaints. And then you see because of the prolonged exposure to the heat, and sometimes the sparks.
The smoke too.
The sparks from the fire can get onto the eyes to damage the eyes. So it's advised that, and even for men who work with the fitting shops, they usually will have goggles that they wear, but Ghanaians don't care.
I can't even look at the lights.
I'm telling you, there are guys who just open their eyes and will be doing that.
So the soldering people.
And you'd have people who come to the clinic and you'd see that there's a spark lying on, there's a foreign body on the eye. And what the eye hates is to have a foreign body on the eye. So it keeps lacriminating, it keeps giving you like tears to just clear that thing off.
Okay.
And it takes a lot of effort to get that thing off the eye.
Okay.
And it could have been avoided by just wearing protective lenses.
Okay. So another one from Kwada. So he says, I did OCT test and I was diagnosed with glaucoma, but my eye pressure was 13 and I have no family history. Of it. My peripheral vision is fine. I want to know if it can be cured.
Glaucoma?
Yeah. So he did the OCT.
So yeah, the truth is that's why we do not use just one test to confirm glaucoma. We usually use a couple of tests. So we look at the optic disc, we look at how CD ratio, that's just science.
So he's asking if it can be cured.
No, it can be managed.
So
yes, that's why he did the OCT and then realized that the OCT actually gives you a broader view of how the nerves have been damaged, how far the nerves have been damaged. And so when it's realized, it's early treatment that's important. So whatever drug that he's on, whatever glaucoma treatment drug that he's on, I pray that it continues, because some people, they just give up at a point. Truthfully, you can be attending to a patient, he or she is doing fine, goes off for about 3 months, come back, and then it's worse.
Okay, well, too bad. We have about 5 more questions, so we'll do that quickly. When you wear the glasses for some time, you find it difficult to see without it. Why is it so? He says he greets you, comedian Dr. Obi, from your guy, Falcao.
The guy I mentioned, the guy we did
he's okay, he's in Dunkorfin.
Yeah, well, shout out to you, Falcao.
His question is, why do we find it difficult to see without it after some time?
Because your eyes have
they've gotten used to the
towards, yes, so it's just normal. Once you take it off, the eye is restored. Like I told you, it doesn't change anything in the eye. It just helps with the refractive prowess of the eye. So whether it converges images or diverges images onto your eye. So once you wear it, it works for you. When you take it off, your eye is restored to its
I think a lot of people are watching you. The questions are coming. I'll try to read as many of them as possible.
I'm quite popular, so.
Yeah, you too. Please, what is the difference between blue blocking What's the difference between blue blocking lens and a photochromic lens? Because most of the designer frames have the blue block lens in them. And is it good to wear them? This is from Bismarck.
Yeah, so the lenses actually, because of technology and because of advancement, we have varieties of lenses. The photochromic lens is the lens that when you're in the sun, it changes color from the plain to a darker form, so that you are okay in the sun. So it could go to it could go to gray, it could go to dark. So when you see people in the sun, sometimes
darker.
It's darker.
Yeah,
so those are yours has that. Yeah, those are photochromic glasses. And then the blue one he's talking about, an anti-reflex. Those are the ones that help with the rays from TV, computer.
But
so
we have glasses that have both the mine does
you have
that.
we have that. We can exactly. So open your yeah, and it helps because some people it helps, especially people who sit behind computers, they tend to develop a condition called a computer vision syndrome, and so we advise that if you use the computer a lot, you would take occasional breaks. Also, people use the computer fail to blink, like the normal rate at which we blink, they do not do, and so they also
Doc, let's move to more questions. The questions
there are more questions.
So please, he's Collins from Kumasi. His daughter suddenly started pressing her eyes, and he's noticed some discharge when she wakes up. What can he do about it?
He can take her to the clinic. to be taken care of.
Okay.
It could be an infection. Yes, because if there are discharges, it could be an infection.
That.
Yeah.
Okay. So, hi, I'm in Takrade, and I'm a big fan of Dr. Obi.
Yeah.
My mother has cataract on the eye, and she's diabetic as well. She has been asked to be operated, but she is very nervous. What advice can you give us?
She has diabetes.
And
so
she has cataract.
Yeah, it can be worked on. If the sugar level is regulated to a normal rate, yes, to the point that it doesn't affect the surgery, the sugar, the blood pressure level and all that. If they are compromised, they usually affect the result of the surgery. And so, I mean, if all things are
good.
Cataract,
she should go for the surgery.
Yeah.
Okay.
If she has been advised to go for it, I think she should go ahead.
She's just talking about the mother being nervous, but I think it's normal.
It's normal to be nervous. It's normal to be nervous for an operation. Yeah. But then once you trust that your doctor can do that for you.
Okay. So Mavis wants to know if glaucoma is genetic.
Yeah.
Okay. Please, Doc, I was told that there's a growth on my eye.
It's not always genetic, though. It could be genetic. Yeah.
Okay. I was told that there's a growth on my eye. What causes that, and what can be done to cure it?
So there are two types, especially the ones that we usually encounter. We have pinguicular, and then we have pterygium. Now, pinguicular is the normal growth. You'd see a bit of a growth approaching the cornea. That's the brown part of the eye, or if you have yours are black. So, and then the pterygium actually progresses. So you'd realize that it's moving from the white to a bit of the black. Some people would have it grow to the point that it covers the whole eye. Now, the more a pterygium grows, the more it restricts the vision that you're seeing. So the pupil, or that opening in your eye, is supposed to help you see. So if it goes to cover it, it will worry. So the doctors actually screen you, look at you, and then advise when it will be necessary for the pterygium to be taken down. Now, to help prevent it, or to help slow the progress, it's advisable you wear protective glasses in the sun, because usually the rays of the sun influence the growth of the pterygium.
Okay. So apologies to everybody or anybody that the question has not been read. I will personally let him give you the answers on WhatsApp. Oh, we have just like a few seconds. Any last minute words, then I'm sure we'll have you again.
Yeah. I enjoyed this.
Questions have been too much.
Yeah. So I'm my last words.
Yes, please.
So your eyes are important, guys. Your eyes are very, which is my camera, this one.
Yes.
Your eyes are very important. Please kindly take care of your eyes. Do regular eye checkups. Don't trust anything from anybody. Go to the right person, not just for your eyes. Go to the right person that you believe. For your health. Yes, for your own health. Yes, and also continue to trust in God. God above everything.
They shouldn't subscribe to your channels and everything.
Well, December 9th, I have a show.
Okay.
So if you are watching me, wherever you are watching me from, December 9th, I have a show, and that's the comedy side. Yes, at the National Theatre. The title of the show is Ghanaian by Card.
I've seen you do it.
So I'm inviting you, and I'm inviting everybody on Hope TV and everybody watching me from home to join me. Let's have some laughs in these hard times. And shout outs to my father. He's watching me. I'm sure he's watching me as a Kwekua Momidia. So my dad, Ivan Sakuokwa Samoa, my mom, Hannah Akwokun, my 3 other siblings, Usia, Efie, Obapa, my friends, and my fans, and everybody who continues to support me. I do not take your support for granted. I appreciate the fact that you guys love me, and then you support me as well. Tomorrow I'll be working at Mother of God Hospital at Ashaman.
Okay.
So
go
at
there.
Ashaman. So if you want
Ashaman to the world.
Yeah, Ashaman to the world. So if you want me to attend to you, I'll be there.
Okay. All right, thank you very much.
Thank you so much for having me.
The time went by so fast.
Yeah, because the conversation was very nice.
But I hope we have you again.
Anytime.
Because you have a lot of questions that you have to
anytime.
answer. Anyway, thank you very much for joining us on in the consulting room. So we have a show, Pella Fest, also in December, on the 31st of December. It's a ticketed event. On our subsequent shows in the consulting room, I'll give us more information about it. But start saving so that you can all go and listen to very good a cappella music from a lot of the popular a cappella groups around. Do well to join us next week. And for those that I couldn't ask Dr. Obi Amponsa about your questions, we will reply you personally. Okay?
Yeah, or DM me your questions.
Yes,
yeah, DM me your questions.
Yes, he will sort all of that out to you. Do well to have a good evening. Go for your review when you have to, and meet us every Monday at 8 p.m. in the consulting room.